Seconds. Are we live now over here, Juan? Okay, we're gonna wave at all these cameras. Okay. Wave, that's one. You ready? You want to silence it and try not to tap on the table because it's very sensitive. So try not to. It happens. Hello, good afternoon and good evening and good morning somewhere out there in the world. We have all these cameras. I don't know which one to look at, so I'm going to be looking at every one of them. Especially right here on WLTH AM 1370 and 92.7 FM, the Region's Choice and the People's Voice. And of course, we're live on YouTube. We have yet to be on YouTube. It's been about a year or so that we have not been on our YouTube channel, but here we are. We're also live on WLTH Facebook page and on WLTHradio.com. Did I say that right? Radio.com, right? So we are streaming live in every camera, every station, every way that we can bring awareness. And that's what we're going to talk about. What kind of awareness do we need to know? A lot. There's a lot of things that we have yet to learn, people. But before I go any further, the views expressed by the host and the callers of this show are not necessarily the views of WLTH Radio Management, owners and sponsors, and advertisers. And I'm hearing my phone talking. My phone was calling somebody. I don't know who I was calling. Got a mind of its own. Does that happen to you? Oh, I was calling the superintendent, Scott Miller from Hammond, Indiana. Well, I hope there was no message recorded there because he's going to say, who's this woman calling? Anyway, happy Friday. Feliz viernes a todos, mi gente. ¿Dónde están? Aquí yo que los extraño, mis queridos amigos, mi familia desde México. Saludos a ustedes desde España. También se les manda besos y un fuerte abrazo. A todos ustedes, Argentina también. Gastón, ¿cómo estás, amigo? And yes, this is a bilingual talk show, so don't feel salty, okay? If you don't understand what I'm saying, but I'm going to go back and forth. De inglés a español, de español a inglés, because I can do it just like that. Bam, bam, bam. So we're going to talk about lymphedema. ¿Qué es lymphedema? Do I even know what it looks like? I sure didn't know. I just seen it in pictures, but didn't know what it was called. So we have an amazing powerhouse here right next to me, Dr. Amira Muhammed, and she is going to tell us about something that a lot of you, including me, not know. And actually, I want to give a shout out to the real reason and the cause why I'm connected with the Indian Medical Association and Dr. Suresh. Did I say it right? Suresh? Of course. Suresh Chandra. And of course, Rashmi. And we had an awesome time last weekend, didn't we?
Yes.
We sure did. I am loving the dresses. So, Rashmi, if you are listening, when you go to India, I'd like a medium or size 6, please. Red with gold. And I'll let you pick whatever design. I love it. I love the culture. I love the music. I just didn't get a chance to dance much to it because I just wanted to watch and learn. I said, let me see first, right? And I make a fool out of myself, although I love to dance. So congratulations to all that you guys are doing. I feel like I'm part of the family, unless I'm not, but I think I am.
You are.
And it's just, it feels great to learn about other cultures, to learn about other languages, to learn about things that we don't normally know. And so here's Dr. Amira talking about lymphedema. I'm like, yeah, we'll talk. She reached out to me and said, yeah, we'll plan it, we'll talk about it, and hopefully before the day of your event. I'm going to turn the camera over to Dr. Amira Muhammed, and here she is. And Juan is somewhere behind the scenes, guys. So he is here in the studio, but I'm going to move this camera over because Juan didn't come here in time. So I apologize, guys. We're gonna, as long as you are seen, we're good, Amira. We're good.
Okay.
She looks good over there, right, Scott? And thank you, Scott, for making it here safe and sound. For those of you that are driving, please be careful. There is no salt really anywhere. I just seen one plow, and that was on Klein, and I was surprised that I finally have seen it after being warned. There was no salt put out there, and I think I should have done it while it was still raining, because now it's all slush with no flavor. Can I have a watermelon slushy, please? No. Just don't get hurt and it'll look like watermelon slush, okay? So you guys be careful. Tengan mucho cuidado en el camino porque afuera está un poquito feo. But this is nothing new, people, so don't freak out. Don't panic, because when you panic, you put the brakes down and there goes your car. Slide right into somebody. So please be careful. Take your time. It's better to be a minute late than a moment of silence. Juan, there's no need to. Oh, let's just say, look, you're on that camera over there. Okay, I don't know what he's doing, but we're not going to pay attention to him right now. Dr. Amira, welcome to Nuestra Comunidad NWI, which means our community, Northwest Indiana. So we appreciate you coming out here, your busy time, professional people. We make our time, but there's a lot of time that we use because of our profession with our patients, with our clients and things like that, right?
This is awesome. I'm glad to be here.
Yeah, and this is something that we need to learn. Juan, do you even know what lymphedema is?
I can't even pronounce it.
Yeah, I don't even know how to spell it. I had to ask Google for it, and I just asked you. Is it E-O-O-E or E for Dema? First of all, Dr. Amira, tell us a little about you. Where are you originally from? And
I'm from India.
What are we doing?
Okay. I'm from India. I grew up in India, and I came to the United States when I was 21. And after
not too long ago, right?
No.
Not too long ago.
I finished my undergrad and I came here to work. And that's been many, many years now, 27 years ago. And
really? When you were 15 years old?
I pursued higher education here, worked here, and we moved to Indiana in 1996 and raised our family here. I have 5 beautiful boys. My husband, AJ.
Boys. Wow.
Cool. So, and I have worked in the region in different hospitals. I'm a physical therapist, and I started seeing this condition called lymphedema back in 2004 is when I was introduced to this illness, and I couldn't believe it. When I saw what it is and what we can do to make it better, I was really interested, and I started working on that direction to get more education into it, get certification, and start working with patients. And whatever treatment we did, it brought so much relief to the patients, and that really amazed me. And the instant result that I saw in these patients, and I said, "Oh, this is beautiful. I'm gonna stick with working on this." So in the year 2006, I started my own private practice so that I can have autonomy. Like working for someone else, usually it doesn't give you the autonomy. So I started my own practice, and I was in East Chicago, Indiana since 2006 to 2019. My practice was based in East Chicago, and I had another one in Maryville, but primary office East Chicago. And we worked with a lot of patients, and eventually I did partner up with St. Catherine's Hospital as well, and I see some patients over there as well. So I've come a really long way, and this is my passion, working with lymphedema, bringing awareness to the region, and educating my patients on this has been sort of my niche, my world. So here I am.
And have you found a lot of your patients that were probably never aware of what lymphedema was until you mentioned it?
Yes. So a lot of times I get patients that come in to see me and they don't know what is going on.
Mm-hmm.
They don't even, it takes them many, many years before they get the diagnosis. And recently we are noticing like there's more awareness in the past few years, the past 2-3 years. I'm noticing like a lot of other practitioners are saying, "Hey, this is lymphedema, go see so and so." So I'm seeing a lot more awareness coming, but it's not enough. It is definitely not enough.
Look, if EVE does not know about lymphedema, then a lot of people don't know, because I have a big mouth. And all for a good reason, guys. Yes, I have a big mouth, but that's to share the information.
Absolutely.
So I am so thankful that you said, let me share this with you, because one, you said you didn't even know how to say the word, so let alone to know what it really is, right?
Right.
Well, Dr. Amira, you showed me some pictures, and I was like, doesn't look attractive. Doesn't look pretty.
Yes.
And I showed it to my daughter on the way out here, and she's like, "Oh, what is that?" I said, "That's lymphedema." Tune in. She goes, "But I'll be working." Well, tune in and share it. And I'm sure people at your job may not know what it is either. All it takes is one person to spread it, just like wildfire, right?
Agree. Yeah.
So let's spread it like wildfire.
Yes, absolutely.
Right?
Let's do it.
What's the worst case that you've seen with a patient that has lymphedema?
Did you want a picture?
Yeah, you guys want to see some pictures? Yeah, you want to see some pictures? Juanito, come over here. The camera will still catch you over here. Come on over here. So when you ask questions, you're on the mic. Juanito is here in the studio, but to the right, away from two of these three cameras actually. But if you're watching on WLTH Facebook streaming, you can see. Oh, I have seen legs like that. Oh my gosh. Okay, guys, this is for adults only. You see that? I'm showing it on our YouTube right now. Look at that. Now we're showing it here on the Facebook. You guys see that? That is not very attractive. That looks like it's painful. Is it painful?
It can be, yes. Yes.
Oh my
So
gosh.
lymphedema basically is abnormal accumulation of fluid anywhere in the body. Okay, usually legs, arms, and there are
Look at that one.
there are two types of lymphedema. Sometimes you're born with it. It's primary lymphedema, and then sometimes it's acquired. It comes from other things, and it's a secondary lymphedema. So the primary lymphedema, you're born with it, and you still need the same kind of treatment. And I'll talk about treatment in a bit. But secondary lymphedema it can be 22% of secondary lymphedema is non-cancer related. 68% is cancer related. So
Wow.
yes, so breast cancer,
Wow.
gynecological cancers, sarcomas, melanoma, anything, head and neck cancers, all these cancers can lead to
AJ.
abnormal accumulation of fluid in the body.
Oof. I mean, it looks painful. Can you do me a favor, AJ, since you're standing there? I'm gonna put you to work. You see that camera? If you can show it to our WLTH streamers, to that camera, right there, because we need to show you what it looks like. And you may have seen, like I have seen people walking with legs like that.
That's
and
true.
not know
what
it is.
Exactly. And I have people that just have lived
Thank
with
you.
it thinking, and then they've gone to people and they've said, you're just fat. And then I've had people say, I have cankles. I've heard that word. What does that mean? Ankles that are swollen, they call them cankles. And they're
Cankles,
I have
like cankers on
and they live
ankles.
with it. A lot of people are living with it, and they
Wow.
don't even realize it can be treated. It is treatable. It can be managed. I'm not going to say like it's going to be cured, because it's more like something that you can manage with.
So there's
with
no
treatment.
cure? Is that what you're saying?
There is no cure, but it can be managed. Just like you take diabetes, you have to take the medication in order for you to be okay, right?
Yeah.
Same thing.
So
Like,
once you
can be
have it, you
managed.
just manage it and control it.
That's
That's pretty much
it. Yeah.
So it's not like it can go away.
No. So
That's sad.
I was saying, well, I'm talking about lymphedema. I'm like not even talked about what lymph is. Lymph.
Well, yeah, break it down.
Right?
Come on,
Right?
Dr. Amira, break it down.
So our body has blood. That's your circulatory system, right? And then there's lymph. Now, what's lymph? Why is it? Where did it come from? So your circulatory system consists of your arteries, your veins, your heart pumps, and all the blood is carried to your tissues, right? And then I don't know how many people are aware of this, but this is basically circulatory system. So, and the veins carry all that blood back to your heart and lungs to get cleaned,
Right.
and then the
right.
cycle continues. It's like a full loop. And your lymph now is a single loop, and what it does is it's produced in your body. So if when your heart pumps, you're about 20 liters of blood is carried all through your body by the arteries, and about 17 liters of blood comes back via the veins. Now there's 3 liters left, right? Like 20 and 17. So then the 3 liters is your lymph. So those 3 liters are created in your tissues. So when you have that blood exchange in your tissues to supply your tissues s- so that the um, the lymph is created from what is the residual fluid left in the tissues,
Okay.
the 3 liters that was left. So that
Mm.
is, what does it have? The 3 liters are consists of proteins, fat cells, that extra fluid that was left in the tissues,
Mm.
and that is carried by your lymph system. The lymph system also is helps with your immunity. It carries the white blood cells. It carries like the you have these germs and things that attack you. What fights it? The immune system. The
Right.
immune system
Right.
is full of those white blood cells, and all that is your lymph system. So it's a really important system, but we don't learn much about it.
Right.
So then we don't know why we need it. So we don't even pay attention to it. So it's really important to understand how important the lymphatic system is in your body, and if there's a backup due to whatever reason, due to I was saying like it can be like the ducts are malformed, you're born with it, like it's or secondary lymphedema, like I said, it's cancer. The surgery, there was a surgery done, and then the lymph nodes were removed, and then there's a lymphatic backup in that area, right?
Mm.
So all these things will contribute to backup in the lymphatic system. It can also be from genetics. It can be obesity. Now, that's a very big reason I want to talk about is
Well, there's a lot of
obesity
obesity going on.
also leads to lymphatic disruption.
People, you better watch your weight.
And the other thing is the last one that I want to talk about is venous insufficiency. If your veins are backed up, your lymphatics are going to be backed up. So sometimes I've seen a lot of patients that'll go for the vein treatments and then they come back and the swelling is still there because the veins were treated, the lymphatics were not treated.
Mm.
So what is the treatment that we are going to do for this condition?
Right. Right.
Right? So
Mhm.
the treatment that we do is called complete decongestive therapy, which is a very conservative management. There are some surgical options and things that are out there, but we those are still very experimental. They're not like very common. They're not commonly available. They're available in university hospitals, but that's only some people qualify for it. Not everybody does. So the conservative treatment that we offer is called complete decongestive therapy. It includes manual therapy. We manually move the fluid to healthier lymph nodes with our hands. Um, the number two is exercise. I will say why that's important.
Did you guys hear someone else besides me to talk about exercise?
Yes, I have to come back to that point again.
Yeah.
So number three is compression. You must have heard of compression socks.
Yes,
Wear your
I've seen
compression
them.
socks.
Yeah.
Wear your compression socks.
Yeah.
Okay, that's really important. We're going to talk about that as well. And number four is skincare. If you saw that picture that we showed you, you will see how there's like one of the pictures has like really hard, darkened, and dry tissue, and that your lymphatic conditions have dryness, the skin dryness. So you have to make sure that you're putting like a low pH or like a pH balanced lotion. Something I always recommend to people is Eucerin, Lubriderm, any of those
Yeah.
non-perfumed
Yeah. Right. Right.
lotions are really and thicker ones that really help take care of the skin at night. But don't put it on if you have an open area. And because of the lymphedema, people have open sores, and that needs to be taken care of. Oozing fluid. It's called lymphoria. The skin just the your body tissue has gets keeps swollen, keeps the fluid keeps accumulating, the body tissue keeps swelling up, and then the fluid has nowhere to go, so the skin breaks down.
Mm.
Skin breaks down, and then there's oozing of fluid. And I'm sure there's a lot of people out there that have
Check your
seen
legs,
this.
people.
Please,
Your
yeah,
feet.
yep. It's really important to do this, and please seek help. That's go to your doctor, tell them, hey, this is happening. Don't ignore it. Don't say I just have swollen ankles. It's always like that, because you're probably on the stage 1 or stage 2 of lymphedema and not even know it.
Exactly. And the thing about it is the diabetics are more prone to having problems with their skin, their feet, and they have to hydrate their feet, right?
Mhm.
I have seen where their skin starts to crack
Yes.
and then it starts to turn colors, and then it can become into gangrene. And
Yep. Go see someone. Go if you see anything abnormal in your legs or your arm, or you see one arm more swollen than the other, one leg more swollen, for anyone that had like a head and neck surgery, sometimes they have lymphedema in the neck.
I've seen that.
Face.
Have you seen that one?
Face.
Where, like what you saw in the leg, like fatty?
It's in the neck.
It's in the neck.
Yes,
I've
yes,
seen
yes.
that, and I had like, I was like, what the heck is
Yeah, I did
that?
had
You know,
surgery
it
and-
looks like a tumor.
You can have
Wow.
edema.
And some of them are
anything.
tumors, right?
Hmm?
Some of them are tumors.
Yeah, but if you're just ignoring it, period,
Yeah.
you don't want to ignore anything.
You
that
have
doesn't
to go
look
get
normal.
it checked out.
Right.
Basically, have a professional look at it and diagnose it and seek help.
Wow. So, exercise. What else to
Oh,
avoid?
yes, let me come back to the exercise part. So why is exercise important for lymphedema? Why? Because these lymphatic ducts do not have any valves to push the fluid up your legs. They do not have anything, any mechanism. Think of your heart. Heart is a pump.
Mhm,
It pumps and all the blood is going
Comes
to
out.
your body,
your body.
right? Your veins have these little valves. They lose elasticity later on in life. All that is there, but the veins do have a mechanism where the valves open and close and pushes the blood up. But your lymphatics do not have any valves that push the fluid up your body. The only way that the lymphatics work is with the muscle, the skeletal muscles, the muscles around the lymphatic system. When the muscles move, when you move your body, your lymphatic flow is better. So we teach what we call decongestive exercises. So in my office, we do all of it. We do manual therapy, we teach a exercise program, we teach you how to take care of it yourself at home.
And so, in exercising, which is great, we all need to really work on our own fitness and our own health. But can this happen to anyone, whether they're
Yes.
overweight or not?
Yes, it can happen to anyone. If you have any surgery, you're prone to lymphatic disruption.
Mm.
Any
A-
surgery.
any
for that matter,
surgery?
Any surgery. Any
Wow.
surgery. So it depends on if you're genetically prone to having an issue with your lymphatics, you'll have the problem more so than another person that's genetically, not as much. So
Wow.
it is familial. It runs in families.
Wow.
Yep.
Anybody that's listening, Dr. Amira Muhammed is here to talk to us about lymphedema. And for those of you that have a medical question, she is the expert, not us. And so we're glad to bring her here. You can call it 219-885-1371. I think we have a caller. Go ahead, caller. You're on the air.
Okay, first I did not quite understand. Could you spell your name, and also I think you mentioned a couple of creams, and also what about the edema?
I'm sorry, what about the what?
Edema, not lymphedema, but isn't there
Yes.
a name, something called edema?
Yes, edema is just swelling. So
Oh.
when the edema becomes chronic, meaning like if it's been there for a very long time, it can become lymphedema.
Okay.
And
And I have your name, please.
Amira Muhammed.
you want to spell Amira?
Amira.
And where are you located, Dr. Amira?
My office is in Maryville, Indiana, off of Route 30. Right now, pretty close to Sam's Club, all that past the mall, but
And spell
probably
your last name, please.
Muhammad.
Mohammed.
Okay, I
Muhammad.
know how to spell it.
Yep.
Amira, Imir, Muhammad. Okay, and you're a physical therapist. And that's what
Yes.
you should be going to. One should be going to a physical therapist if they experience this type of disease.
So not any physical therapist. There are only few people that are trained to do this. So you should be going to someone that's a certified lymphedema practitioner.
Thank you.
Thank you, caller.
You're welcome.
Appreciate you calling in. This is Nuestra Comunidad NWI. That's our community, Northwest Indiana. And of course, the calling number is 219-885-1371. We have opened the phone lines. If you want to ask a specific question about lymphedema or have to do with that, we have a special doctor that actually is certified, as she just mentioned. You just can't go to your physical therapist that you've been dealing with because of your back or some type of body injury, right? Or your arm or your legs. But So this can happen to anybody, but even though I've mostly seen it in the older people, and if they're younger, they're overweight. I mean, at least that's how their legs look, right? But it could be all the lymphedema that's making them look like they're overweight. Can that be, or is it a combination?
It's a combination, I would say.
We have a caller. Go ahead, caller. You're on the air.
Okay, good evening. How you doing?
Good. How are you?
Okay, I just want to ask Doctor one question.
Go ahead.
When they talk about neuropathy on this TV, what is neuropathy?
Neuropathy. What is that?
Neuropathy is numbness and tingling, and in your feet, in your legs. Do you have that?
That deals with nerves.
Sorry, it's with nerves. Yeah.
I know you're 1,000% right. That's exactly what Doctor said. You know exactly what you're talking about.
Well, you're talking to a doctor here, so she knows what she's talking about. Cleveland.
You hear what I just said?
Are you trying to seek help for that? Is
Like
that
if I ask somebody for a neurosurgeon, every doctor don't know about a neurosurgeon. What he do that for dealing with the veins. That's why I asked Doctor that question. He's not trying to say that she didn't know.
I'm just messing with you, Cleveland.
Oh, okay, sweetie. Now look.
Yes.
Would you go to a podiatrist? What would you go to look at your neuropathy?
Do you have diabetes? Sometimes it can be due to diabetes as well. You should go to your primary care doctor
Wait a
first.
minute, is this Eve or who?
No, the who's talking to you is Dr. Amira.
Okay,
This
Doc.
is Amira. So I would go to my primary care doctor,
Oh, that's what I'm asking.
and they can check it out and tell you if it is or not. There can be different reasons for numbness, tingling in your feet.
Yeah.
So sometimes diabetes can lead to neuropathy. You can have some. So it depends on. You should go get tested. You should go talk to your doctor, and then they will send you to the right
I don't
place.
want to go through that test anymore. That woman shocked me with that big thing. I jumped up that bed.
Are you afraid of needles, Cleveland?
No, I didn't say a shot. Okay, let's just say I got something in my hand and I can just go around giving people a hard shot on their butt in their hand. That hurts bad. That thing hurts bad. I told the doctor I can't do it no more. I'm gone.
Okay, thank you, Cleveland. Appreciate you calling. All right. Actually, my mom had neuropathy, and her feet would go numb, and damage of the nerves. So
Yes,
that can be serious.
So
You can fall and not know.
with your doctor, and they can direct you
For
to
sure.
the right doctor.
Always start with your primary physician. Now, if it's about the teeth, please don't go to a physician, go to a dentist. Now, if it's your eyes, which I was on the phone with a doctor, and she's like, why do they want to come see me for their eyes? They should go see my doctor. Actually, I was at the doctor's office, and they're like, why do they want to see me about their eyes? They have watery eyes. Go see an eye doctor. I'm sorry. I thought that was funny. But anyway, so because we are not aware of lymphedema, you have scheduled something that's taking place this coming Monday. So is that
Yes.
the day of National Lymphedema Awareness
World
Day?
Lymphedema Day.
Oh,
So
okay.
Monday
World
is World
Lymphedema.
Lymphedema Day, March 6th.
World Lymphedema Day.
And
Walking?
we
You joining us? I'm gonna send you
celebrate-
the link.
Yeah. So March is Lymphedema Awareness Month, and Monday, March 6th, is World Lymphedema Day, and we are hosting a walkathon in Dean and Barbara White Community Center in Maryville. It's an indoor walking track, and we would love for people to come in, support us, walk with us. It's a 3K, but you don't have to walk all the 3Ks. If you have like mobility issues, if you're not able to walk that much, you can have someone else walk for you. Like, bring your granddaughter, grandson, son, whatever, bring anyone. Maybe they can walk for you, and you can register, and you can register on site over there too. But we wanted people to register before, so we know how many people are coming.
Right,
But we would definitely, if you want to come, please do come in. It's at 6 p.m. in Dean and Barbara White Community Center in Maryville, Indiana. And this is our first time we are hosting this, and we want to keep doing this every single year. And we want this to grow, to bring more awareness to everybody for this debilitating condition. And I want to thank you for
Yeah, no, and it
wonderful.
actually, in seeing those pictures, it's probably even affecting in the way they walk,
Oh yeah, definitely.
which can affect the back,
Yes.
the legs, the skeletal, the spine, because they're walking now different. Because we're gonna have to show you these pictures again. They're a little graphic. So AJ is so kind, which is Dr. Amira's husband, is going to show the pictures on streaming, WLTH streaming, and then we'll show some pictures here on our social media for Nuestra Comunidad. They look a little disgusting, people, but you know what? Let's keep it real. Just saying.
This was there's a picture, there's a thing we have where we have like the one before the treatment, and then
you want to give that
that
one to
one.
AJ, and I'll
Yeah.
share, because you sent me that picture here, so I'll
Yeah.
share that picture here.
Yeah.
That it looks a little
So I
gross,
wanna show-
people, but you know what?
This was
Let's put
before
you some
treatment.
scare tactic in you to know that you have to know what it looks like, guys. I mean, have you guys, and I'm looking at the social media on Nuestra Comunidad and also on our YouTube channel. This is a little grotesque, but you know what? We have to show you what it looks like. Juan, have you ever seen this?
I've seen big.
You've seen some of this, right?
You've seen, yeah, we have all
And
seen,
not
but we
know.
don't know what it is. Yeah,
It just looks like an infection to me.
yeah.
And it looks like you need to see a doctor. But I know that there's people out there that don't pay attention until it gets worse.
Yeah.
What worse can it be? I mean, how bad can it get if it's not treated on time?
Do you want a picture?
Yeah, please.
Okay.
I'm gonna keep it real, people. By the way, she is coming on Real Talk with EBE. It's a little
Okay.
different there.
Okay.
It really becomes
This
very real.
one.
Oh.
So then
AJ, you want to
there's-
show it over there first,
there's
please? I'm sorry, excuse
underlying
me.
wounds in it too. Like the skin becomes the tissue becomes like bark, like it brings skin changes. So the skin looks like a tree bark, basically.
That's what it looks
loses-
like. A
It
dark,
loses
dry
its-
bark.
Yeah,
tree
it
bark.
loses its
Life.
elasticity, everything, because
Can
been-
they
it's been left-
lose their feet? Or
it can be, because if you keep getting a
There's
wound,
no
what are we
flow.
gonna do, right? Like if the wounds keep, that's a wound.
gosh. Guys,
There's so many wounds
look
that
at that.
pop up because of that. Yeah.
this needs to be taken care of immediately. If you have a loved one that has a foot or leg that kind of looks a little not quite this bad, get them to get it checked. I mean, this is all seriousness, people. We have to start taking better care of ourselves. And if we continue to take better care of our vehicles, our cell phones, and all these objects and devices that are replaceable, and we keep ignoring ourselves, don't be a hypocrite and tell me that I should care for myself when you're not doing it yourself. Don't be a hypocrite and tell me you need to drink water when you're not doing it yourself. Don't be a hypocrite and saying, I don't need to go to the doctor, but you do. No. And don't wait until something happens. Many people, I don't know, I don't think it's a human nature of ourselves, is the lack, it's being ignorant. And when I say ignorant, people don't take it wrong. That's just not knowing. That's what the term ignorant means, not knowing. Don't you want to know? Don't you want to catch something on time? I mean, I was talking to you earlier, Dr. Amira, that we're so quick to make sure we keep our cars running. You can buy a car, okay? Well, why aren't you making sure that this vehicle, which is the vessel, is working? Tune up, the battery, that's the heart. Hello, the mufflers. We got to get a colonoscopy going on, okay? We got to get that colon screening.
Yep.
Juan, colon screening is important. Many men die of not knowing because they didn't care for that. My grandfather had colon cancer. There was not a lot of awareness out back in the day in Mexico. He passed in 1985. Doctors are like awareness of colon cancer. He thought he just couldn't go to the bathroom. He thought he was just constipated until it got too bad. And now what? Don't be embarrassed to talk about it, people. And I'm going to say something, and somebody needs to hear this, whoever's watching, because I'm led by the Spirit. You need to hear this. When you go to the bathroom, you better look in that toilet to see what things look like. It's not embarrassing. It's to know, is it too yellow? Is it green? Is it red? Is it what color? Is it white? The stools and the urine, if you look at these colors and they don't look normal, you better do something about it. And I'm not trying to freak you out or scare you. We're talking about health, how to care for our feet. You got to keep your feet hydrated. You got to keep your skin hydrated. I learned that through my father. He didn't care much about his feet. I had to care for his feet. Find the thick lotions, odorless, obviously, that are going to help to keep the foot moisturized and not dry. The nails, they start growing with fungus. They start in your fingers too, in your hands, not just your toes. So now we're talking about lymphedema, the lymph, the edema. If your feet are swollen and continually swell, figure out why. That's probably some water retaining, maybe. Right?
It is. It is. It's fluid retention, of course. It starts with just so I wanted to also say, like, there's stages of lymphedema.
Yes,
There's, like,
please
stage
inform us,
1,
educate us.
Stage 1 to 4. So stage 1 is there's an underlying problem. You have a swelling in your ankle one day, and you elevate your leg. You went to bed, and then next morning it's gone. So it's probably any swelling. It starts like that. It starts with a little bit one day, and then you didn't pay any attention to it, and it was gone. And you're like, oh, okay, no problem. I'm good. Stage 1 already set in. Stage 2 is it keeps happening. Maybe after 3-4 months, you noticed it was swollen again. You put your legs up, you went to sleep. Next morning, it's still there. So then that's your stage 2. So it's no longer reversible. And then when that happens, you need to seek help for sure. And stage 3 is when you started. I showed the picture with the red hardened, when there's like the tissue becomes hard to touch, almost like a leather. If you touch that area and it feels like leather, you know it's not right. You got to go see somebody.
Like rubber.
Yeah. And then stage 4 is when there's the bark-like. If it becomes bark-like, if you have open areas, you can have open areas already in 2 sometimes. Some people can have that. So what would I do if you see a stage 1, when you felt that swollen ankle right away, start elevating your legs. Invest in a $20 compression sock from Amazon if you have to. Even when that little bit will start helping you. These compression socks can be very pricey. I have to tell you that. When they're very pricey, insurances do not cover a lot of these compression socks. So it's a little problem right now. But next year in 2024, Congress has approved, Medicare has approved for all insurances start cover compression garments. That starts next year. So we still have almost 10 months.
But we're going to spend that amount of money on something else that's not going to help us.
We do.
So it costs us and it pains us to spend money on ourselves.
Yeah, that is true.
But we'll go and get our nails done. That's over $100 some. Get our hair done. That's over $100 some. Juan, how much do you pay, if you don't mind me asking, when you get your hair taken care of and your brows?
Probably 70.
Woo. But we think twice about getting something that's going to help us feel better, that can help heal whatever part of our body may be needing.
That is true.
But we don't think twice about other stuff, superficial things. Why is that, folks? When we really have to take care of this vessel, this body, that once it's gone, bye, Felicia, can't come back anymore. We're done.
True.
One and done, that's it. But these cell phones, they even have insurance. Okay. You got your stuff insured, don't you?
No.
People insure their refrigerators, their stove.
I didn't.
You don't have your cell phone insured?
No.
Oh, I'm surprised. You're the one that always says,
Yeah, but
you don't have it protected? What? Why don't we even insure ourselves? We think twice about that. So moving forward, let this be a day that you start caring more about you. Numero uno. Tú. No one is going to do it for you but you.
That's true. Absolutely.
I mean, people can walk for you, but how good is that going to work for you? It's not. People can eat healthier, but they can't do it for you. You have to do it.
That is true.
It all starts with you. So Dr. Amira, thank you for opening up our eyes to lymphedema. I've heard it, didn't know what it looked like. I've seen it, but didn't know it was lymphedema. And the word lymph and the word dema, I mean, you break it down, you find out what it really is, right?
Yeah.
So those that are just tuning in, give us a definition of lymphedema again, please.
Lymphedema is an abnormal accumulation of lymphatic fluid in the body. Lymph is present in the body. It's about 3 liters of lymph fluid that's carried in your body every single day. So if there's a disruption of flow somewhere in the body, then it's going to back up and it's going to end up having swollen legs, arms, neck, whatever body part is affected.
Any questions, Juanito?
Buffets. I was just at a buffet not too long ago. I think when it comes to Chinese buffets, I don't know if you can actually get the big belly or whatever overweight on a Chinese buffet. This was a regular buffet. I hadn't been to a regular buffet in a long time, but there was one lady there who was really kind of large there. I don't know if there were brothers or sisters or she was the mom, whatever the case may be. I couldn't tell, but everyone else was thin at that table. Then there's another table where pretty much everyone there, a family, was big. So when you see, I guess, a family that's pretty much they're all big, how would you maybe try and reverse that if everyone in the family?
Okay, we're talking about lymphedema.
Right.
Are you
So-
talking about
so what you're
overweight?
calling
That's
overweight-
another doctor
No,
coming on soon.
no, I mean-
Robert, I don't know if
okay.
you're watching. You'll be coming on soon and
So,
talking
but
about
does that
obesity.
contribute to what you were talking about right now? or
Can
not
it
really?
contribute?
Obesity your waist and hip ratio being high is a risk factor for lymphedema. Yep, definitely. Obesity definitely is one of the reasons. So when people lose weight, they definitely lose a lot of that. Your risk goes down.
Well,
when you
that's
lose
why I
weight.
was asking earlier,
Right.
is it more in the heavy set people or thin people, or does it matter? But if you're going to be watching your weight, then that's a good way to reduce the risk, right?
Oh, definitely. So I have we have some YouTube videos from some of the previous patients and things like that. Not mine, but my instructor. So there's a story of this this young lady that was diagnosed with lymphedema. It took her years to get the diagnosis, but she had to go get the bariatric surgery, and after that, she definitely lost a lot of weight, and then and on side by side, she also was getting the lymphedema treatment. So then both together changed her life, and then she ended up started wearing compression socks later on, and it's treating the body as a whole,
Right.
It-
Which you
it's not like
can
just one
live
body
a
part.
normal life, right?
Oh yeah,
As long
of
as
course,
it's
absolutely.
controlled, it's treated, caught on time, and not be ignorant of it. Pay attention to every sign of your body.
Home program includes your compression stockings or sleeves or glove, whatever, whichever body
And this
may
is to
be.
reduce swelling.
So when we do the manual, yes, when we do the manual therapy, we're pushing the flow weight, right? But then you need to maintain it. How are you going to maintain it? You're not going to come to me every single day of your life and I keep working on it, or you find a
You gotta do
massage
things on
therapist,
your own.
whoever. But you need a maintenance program. How do we maintain it? With a compression. So once you're done with your therapies for this, or if you're going to manage it with, make sure you're doing compression afterwards. Maintain it. And every compression socks or sleeve or whatever, one of those, they do not last for more than 6 months. So if
Don't try to hold on for them
if
too
you
long.
have a compression socks that you got 2 years ago and you've been wearing it, doesn't fit you, please get rid of it. Get
It's
another
not doing
one.
its work.
Yep.
It's
It
supposed to.
loses its
Elasticity, and it's not
and then you're like, well,
fitting
I'm still
right.
swollen. I'm wearing compression socks.
right.
Ill-fitting compression is really not good for you. So if it's too tight or too loose, or don't wear it. Get another one.
And if you're not sure the size of the socks, there are some pharmacies where I used to get my parents all their supplies and things. They also had the diabetic shoes and things like that. They come and consult you to make sure you have the right socks.
probably.
Not
I
all the
guess I
pharmacies,
agree.
but I know
There are
are
some, yes, there's some.
that will do that in case you're not sure if it's too tight for me. It'll cut my circulation off.
Yeah, you can ask us too. Like my office will help you with that as well. So we can help you with compression socks. We can help you. We're here. So
Well, you
have
guys
any
heard
questions? Ask us.
Dr.
We're here.
Amira. Any other questions from you, Juan?
Not at the moment.
Okay, cut off the buffet. Okay. Since you're bringing it up about the buffet food. You
Oh, I
know?
should tell you one more thing.
Yes.
Sorry.
No, it's okay. We have a
I'm
few
not
more
a
minutes.
dietitian, but a lot of people have to please make sure you watch. If you're swollen,
That
please
sodium.
watch your sodium.
Watch that sodium. Oh, some people don't know where the sodium is.
Salt.
This is what my
salt.
dad used to say. It's not salty, so it's not high in sodium. Oh my gosh. It doesn't have to be salty. It's still high in
Yeah.
sodium, like the soy sauce, the
Yes.
ketchup.
So read your labels
Yeah.
for that sodium content. And if you're swollen, please reduce your sodium content in your diet.
That way you're not prescribed water pills. That's another
Yeah.
drug.
Oh,
Try to
yeah.
avoid everything healthy and
you opened a
yourself.
can of worms with a water pill thing. You just opened it. Sorry. But here's the thing. I know a lot of
took
my
care of
patients
patients that had water pills today.
So I know a lot of my patients go and they get put on diuretics for lymphedema.
Mm,
Okay. Diuretics do not work for lymphedema because the fluid is more gel-like.
mm.
It's hardened. It is not watery. So if you're on a diuretic for your high blood pressure, cool. Go ahead. Please take it. You need it really bad. But if you're going to be using diuretics to get rid of the lymphatic, it's not going to work.
No bueno.
Yep.
Wow.
Thank you.
Well, it's 51 minutes after the hour. We're almost at the end of the show. Issues and Answers is coming up next with Reverend Scott. And I'm sure they have some important topics to talk about as well. Juan didn't get a chance to talk about politics today, but he'll probably talk about politics tomorrow. Juan, what are you talking about tomorrow? Go ahead. Oh, you got announcements? Well, Dr. Amira, we want to thank you for coming on. We're going to bring you on the other show in a few,
Okay.
in a day or two. You'll be on Real Talk with EBE. My conversations are more straightforward there because it's real talk about real issues with real people. And if we don't do that real talk, the conversation that makes you uncomfortable, when will we ever learn?
This is true.
I used to always say, I respect my enemy more for telling me the truth than for my friend lying to me.
I agree.
Okay. So on that note, Juanito, you got some announcements. A ver,
Sure.
¿qué dices allá?
Well,
Thank you.
actually, tomorrow
Thank you
is
so much.
Saturday, March the 4th, and at IU Northwest, 3400 Broadway in Savannah Center, 12 noon, is the public legislative update hosted by Earl L. Harris Jr., co-hosted by Representative Reagan Hatcher and Dr. Vernon G. Smith and Senator Eddie Melton. So they will talk about what's going on downstate and give an opportunity for the audience to ask questions. So that is tomorrow. Also, Indiana Filmmakers Network. Their website is Indiana Filmmakers Network, indianafilmmakers.org. We have our next meetup on Thursday, the 9th, beginning at 6 p.m. It looks like it's just going to be strictly by Zoom. And so you can go to the website for more information at indianafilmmakers.org. Today was the very first day of our fish fry at St. Patrick's Church. It's not what it used to be before COVID, but we do have tilapia dinner, perch dinner, shrimp dinner, and combo dinner.
Sounds tasty. Sounds high sodium.
The dinner includes a coleslaw, macaroni salad, and potato taco, including papas, ensalada de col. Is that C-O-L? That's what it says. Ensalada de macaron y tacos de papa. Enchilada dinner, $10. Potato taco dinner, $10. The other dinners are $13. So today was the first day, and it is from 11 a.m. to 6 p.m. or until sold out. So that could be every Friday. And then we have our feast day of St. Pat's on March the 19th with a bilingual mass at 10:30. Celebrant Father Diego Flores, catered luncheon, family style at 12 noon, and entertainment by the Mayor Irish dancers and bagpipers. Tickets are adults $20, children 7 to 12, $10. That will be coming up. More information about this tomorrow.
Nice. So this is a t-shirt for you to wear on Monday. You're gonna wear it Monday so we can walk. And guys, for those that are watching on social media, we're actually going to share the link so that you can register. It will be shown on the streaming. It'll be shown on all the YouTube and Facebook page. And of course, how else can we find where to register? If you go on my social media pages, you will see the link there, register. It's only $10, but the awareness that you're getting out of, I think, is priceless. Juan, did you learn something new today?
Sure.
What'd you learn?
Can I pronounce it? But anyway,
Lymphedema.
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 Yes, there you go.
Well, I learned that we have to, like you both were saying, we have to take care of our bodies, and then when you overdo
Go see a doctor.
anything, it can lead to.
Yeah, we
lymphedema
could be
and-
feeling fine today and haven't
Yeah.
seen a doctor in 20 years, but it could happen just like that. So, guys, really take care of yourself, love yourself some more, respect your body, know what you're feeding it. Okay, if we keep feeding junk in, guess what we're going to be giving back? Junk out. And it's not going to look very pretty and it's not going to feel good. They say, I'd rather die happy. Well, let me see which person has died happy that has eaten very unhealthy. I doubt it very much that they had died happy, because when they were in their dying bed, they were in pain, hooked to machines and tubes and all of that. And I don't see any happiness in that. So love yourself. You got parents and you got family that cares for you. Come on, we got to do this now. All right. Nos vemos mañana. We'll see you tomorrow here on Nuestra Comunidad NWI, WLTH, AM 1370, the Regis Choice and the People's Voice. Nos vemos mañana. Until then, see
It's
ya.
10 o'clock. A las
A las
10
10 de la mañana. Love you guys. Peace to you. All right. Nos vemos mañana.